I've neglected and deferred and put off doing this video for a number of years. One, because it's a personal video for me. Two, because I'm not sure I can give it the due justice that it deserves. Both my mother and father have had strokes that have taken their quality of life. It's impacted them greatly with what they were able to do. It impacted my father a second time over and is what actually was one of the causative agents of his death. And it's huge in the African American community for a number of different reasons. In addition to it being debilitating from a mechanical standpoint, it can be debilitating from a pain standpoint. And in a pain standpoint, it frequently is underdiagnosed because the patient can't be an advocate for themselves. Many times they have issues with speech, cognitive assessment and function, and clarity of thought to really be able to give individuals true understanding of why they hurt. And that pain that is present is frequently thought to be because of other causes, as opposed to it being due to the stroke. So this video is going to endeavor to explain to you how that causes a problem, how to assess it, how to talk with your clinician, and hopefully how you can find help. In this video today, we're going to talk about pain that develops after having a stroke. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients understand why they have pain, what their options are, and how to beat the living bejesus out of the pain that bothers you and get back to living the life that you possibly can. We talk about stroke. Stroke has two different variations for the most part that have significance. The first is it can be hemorrhagic, meaning so that it has blood that ruptures a vessel and injures the surrounding nerve. Or it can be ischemic or thrombotic in nature, meaning that blood flow is halted by a thrombus or clog that plugs up the vasculature and prevents blood flow from reaching the area that it needs to. And consequently, there's decreased nutrients that are supplied to the nerves. We talk about stroke when it affects particularly certain areas of the brain. It has a higher likelihood of having oriented pain issues, which many times healthcare providers don't always assess, evaluate, and lean into. About 11%, or a little bit more than 1 out of 10 patients who have a stroke, will have some form of central mediated pain, meaning it's not from them just having inability to be able to move the limb or less range of motion. It's coming from a neuropathic cause that's central, meaning the brain or spinal cord. And treating those issues can be incredibly difficult. If those areas where the stroke is in place, whether it's hemorrhagic or whether it's ischemic, is located close to something that's called the somatosensory tract, which is the part of the brain that lets you be able to have movement, meaning that person had paresis or some areas of inability to be able to move. It's highly likely that about 50% of the time, there's a central mediated source of the pain. And in treating that, you can't just treat it in a traditional way. It's much more difficult to be able to manage. Most people that have pain because of a stroke, 50% of them will have that pain within the first month. However, it's not always the case. Evaluating for post-stroke pain should continue for as long as 1 year after having the stroke. So you really want to be diligent with evaluating, does that person hurt? And you may need to use a number of different ways to be able to convey that point because it may be challenging because of the person's cognitive ability following the stroke. In terms of treatment options for stroke, historically it's been pharmacologic in nature. It's relied upon things like anticonvulsants, antidepressants, medications along those lines. Interventionally, now there's becoming a larger and larger push for looking at neuromodulation. So how can you influence the nerves without it being through pharmacy or chemical only? So things like deep brain stimulation, and now things like transcranial magnetic stimulation, which is one of the things that is done in my practice that we've elected to do. When you look at stroke pain as a whole, it's a debilitating, devastating source of pain that is clearly unrecognized and needs to have a much larger voice for those people who can't have a voice for themselves. If you or someone you know has this type of pain, please reach out and get help and find a way to be able to get that person the ability to have some degree of quality of life so they can be able to do the things that they want to be able to do. Thank you so much and have a great day.